one. Good evening, everyone. I'm very excited to have this conversation. I have two guests here this evening, Annabelle and Marie, and we are going to discuss, this is a part 3 of this series, this virtual panel series on the family doctor shortage on Vancouver Island. And so Annabelle and Marie have graciously agreed to be here to speak about to tell us what they want to tell us about on the topic. So welcome to the show, Annabelle and Marie.
Thank you.
Thank you, Adrian. I appreciate your concern and bringing this huge critical problem to people's attention, especially in Qualicum Beach. I have worked on the front line in healthcare, in long-term care, home care, activities, bathing nurse for over 16 years up and down the island. And I have seen firsthand as a frontline worker, especially in the community of Oceanside, the severe lack of primary health care where doctors being available. If you look in today's paper alone, you'll see that they say only 56% of our population in Oceanside. And if you look at our population statistics, that leaves 44% of our population in Oceanside, over 22,000 people without a primary frontline healthcare worker or a family doctor. And I guess that begs the problem. Well, is it a problem of not having enough doctors, or the system being antiquated and the walk-in clinics, which we don't have? I specifically walked into Flowerstone Healthcare Center this morning to find out what the story was firsthand. And I was told, you know, I think in the newspaper it said, as of January 21st, when Flowerstone opened, there were 2,000 people who had applied for an opening for a primary healthcare worker in Oceanside and Qualicum Beach, and that only 50 positions have opened up, and that you have to go through the healthcare link, that it is not a drop-in clinic, and we do not have drop-in clinics. That begs the question of the old family doctor, the fee-for-service system. It's not working, it's antiquated. Many new doctors do not want to work and set up a business and have the expense and the liability of setting up a family doctor. They need, and the BC government is now new strategy in 5 communities, major communities like Burnaby and other ones, to set up this team approach where the doctor can come in and work with the team, whether it be nurse practitioners, mental health workers, physiotherapists, midwives, the whole team can work together. And that's what Oceanside Healthcare Center was originally developed and built to do. And I worked in the home care section upstairs. This has since become an urgent care. But in the meantime, personally, from a personal perspective, I have not been able to find a frontline healthcare worker in in Qualicum Beach. I am still relying on a frontline healthcare provider in Duncan, an hour and a half away. But luckily during COVID, you know, on the system has really had to streamline, and I've been able to talk to her on the phone in a timely manner without going into an office and waiting for 2 or 3 hours. And she's been very helpful. But on the downside of that, for people, especially seniors who have complex care needs, who need that longitudinal connection, personal connection, trust with a family doctor or a frontline community healthcare worker to follow your history. Yes, minor things are not necessary in the history, but there's a lot of people who are slipping through the cracks with chronic diseases like cancer and heart disease during COVID, who are not getting diagnosed in a timely manner. And according to the Canada Health Act, we deserve, and through law, deserve to have access in a timely manner to a primary healthcare provider, and we are not getting it here. You look, they say that 70% of Vancouver Island has a regular family doctor, but one of those 5 people have to wait more than a week to see that family doctor. Specialists, it's 4 weeks or more, sometimes months, and sometimes over a year. So that being said, we are only at 56%, so we are well below that number. Also, our numbers, 18.2% of BC members do not have access, and so we're in the top 3 that do not have access to primary healthcare workers in BC, and we've got to change that. So I will provide you with access to emails, both to your MLA as well as to patient quality care at VHA to contact about this and actively do something about this problem.
Okay, thank you, Marie. Thank you. Annabelle?
I'll just walk you through a little bit of personal history with the healthcare world. So I, like many, have relocated to the island, but my earlier history with the medical system in British Columbia is that I spent probably 30 odd years on the mainland. And in that time, I had 4 different GPs. Each time was related to a retirement where they could not sell or decided not to sell their practice. And so therefore, anybody that was part of that practice had to go look for a new GP. So we had 4 over there. We finally landed on one, I can't remember now, but let's say 3 or 4 years ago. Very modern clinic. It was one of the first clinics in the country to work remotely in terms of having these video conference calls we're doing now. In fact, the founder of the clinic is a gentleman behind, a doctor behind the technology that is now being used today for what we were doing during COVID. And anyway, so bottom line is that we've been victim to retirements and all of those things where there is no other option but to look for a new one, and it's basically about praying for the time that you might get one. Fast forward to being here, we now are part of a different health authority. So I have opinions around health authorities. I think as a province we should have one, not I think it's 8 or 9. I can't even remember now. Health authorities don't always work in the same way, which we know. And to get a GP here or a nurse practitioner here is insurmountable. So at this moment in time, we are working with our GP still on the mainland. Having said that, recently the GP announced that due to, I believe, some standards executed from the association they belonged with, and I'm sorry, I just drew a blank on that, Physicians Association, or whatever they're called, apparently we are not allowed to be patients of this particular doctor anymore because we are out of her geographic area. And so we're kind of forced in this position of, okay, so okay, fine, we'll just give it up and we'll just hope and pray we find something over here and go on the wait list and could be here 24 months, 36 months before we find somebody? Or do we just kind of fudge our way through and just stay with that GP until whenever? So we're kind of forced into this situation. The one thing that I will say about that last scenario where we've been told that we are no longer in the geographic area, when we first moved here, we brought a senior with us who was in the last stages of life. And so we actually were very fortunate to get that senior associated with a local practice. And that local practice actually offered for us to also become their patients because of the senior being there. And because our doctor on the mainland had originally said that, no, we can manage you from afar, because we were very transparent when we moved here, we said no. And now here we are. We're now being told that the practitioner on the mainland can no longer service us. And now we have no access to healthcare. So, I think the other thing I want to say is that we've looked after 2 seniors in the last 24 months. One, both to begin with were part of the Fraser Health, then were part of the Coastal Health, and ultimately part of the VHA. And I can't tell you how difficult it is to navigate different health authorities because not all things run the same way. And sometimes in many cases, you have to relearn the system. And so, for example, palliative care means certain things in certain districts or regions than it does in others. Services that fall under palliative care vary from region to region. And so, you have to be very aggressive with managing healthcare. You have to ruffle a few feathers. You have to manage, you have to self-manage, you have to
Self-management
understand the
is
system.
crucial,
It's
crucial.
very crucial. And you have to self-manage. And very fortunately, we are in a place where we navigate that quite comfortably. But when we talk about seniors, that's a different generation, very different approach. They don't have the courage or the know-how to manage their healthcare. And so they fall very victim to being told what to do, or just, oh, well, that's the way it is, or they don't question things. And so they can fall victim to the system if the system is broken. So at the end of the day, we have some advancements that have happened in the healthcare system in British Columbia in the last probably about 7 or 8 years or so. The nurse practitioner program is probably one of the best examples of that. It's taken the pressure off doctors, even in the hospital environment, where they can manage some of the ordinary daily things that come along and leave the doctors to really deal with the specialty areas or critical situations. And so that model is very clever, and it was first founded and tested actually in the province in Nova Scotia, and we actually happened to experience it firsthand many years ago in Nova Scotia. So it was a very interesting model to see there, which is now working over here. But at the end of the day, we still have a shortage of nurse practitioners, and we still have and then we have an even bigger shortage of GPs. So it's a very large problem. There's an education component. So if you talk to people and you talk about a nurse practitioner, there's a lack of understanding about what that person can do and what their qualifications are and what it means to have a nurse practitioner. The GPs are becoming less and less because, as you mentioned, Maria, there's a liability, there's a cost, and the business model isn't making sense to them anymore. And so they're actually going to specialties, or they're just signing off and having nothing
Walk-in
to do.
clinics, easy breezy.
Right.
And unfortunately, the fee-for-service model in BC is not working. It's antiquated.
No, it's not.
I've talked to people from Manitoba where the new doctors being trained would rather go into a team's scenario where they can be salaried or paid by the hour, and it doesn't matter how many people they've taken care of. They're doing the quality care that seniors need for their complex care in a longitudinal way to be taken care of properly with quality and consistency, so they don't slip through the tracks. They're getting follow-up for cancer screening, follow-up for heart attacks and that sort of thing. And I've recently been in touch with the self-management program with the Center for Vancouver Island, Vancouver, UVic, University of Victoria Center for Aging in Delta runs a self-management program online, and it's internationally recognized. Specifically, the chronic pain self-management program runs for 6 weeks to reduce the critical crisis of addiction and overdose going on with COVID right now, just as one example. The Elder College provides little to no cost for health courses at VIU. Those are and I will be sending you some contacts with that as well. So there's many things that can be done, and we have to take responsibility for our own self-management of healthcare, because the healthcare system is taxed to the max and they can't do it. They can't cope during COVID. The doctors are getting burnt out. That 30 to 76% of them can't handle the stress of COVID right now, let alone the normal stress of the healthcare system. So we've got to change things. We've got to improve them, make them more efficient, more cost effective, etc. So definitely.
I think in my mind, whatever we do as a province in terms of all those things you've brought up, I think that we need to see a re-education to the user of services, regardless of age.
Yes.
And so a really good example of that is that in the old days, when you found your GP, you would want to know if the GP, which hospital the GP was associated with, so that if you ended up in the hospital, the GP in the old days would come and visit you and they would do their rounds and all the rest of it. What people don't realize today is that as soon as you step over the threshold of a hospital, any of your external doctors are no longer involved. The team at the hospital takes over your healthcare. Most people don't realize this. So at the end of the day, although your records may be transferred over there, there may be a consult with your GP, your specialist, or whatever on your state of the health The fact of the matter is that once you step into the hospital, you are now under the team's care within the hospital, and all of those peripheral bodies disappear. And most people don't realize that. So when most people are looking for a GP, they're thinking that that GP will see them through anything that happens in their life, crisis or not. And that's not the case. And so in addition to the broken pieces around healthcare and all the things that we read about and talk about and all the things that have to happen in healthcare, the other side of the coin is that there's a huge demand for re-educating the user in terms of what to expect. What does each position really do? How is healthcare today different than it was even 10, 15 years ago? How has technology played a role in all of that? The mystery around what is this telehealth thing all about? What is that? How does that benefit? How does that tie into some of the resources that would exist in each health authority? So I feel like we have a tremendous amount of work to do in fixing the actual system, which systemically is very, very damaged and broken. And no one's going to solve that puzzle anytime soon. And at the same time is really re-educating the generations, all the generations, not just a generation. Everybody's at risk at the moment. And one of the things that we really need to be thinking about is that although the largest percentage of our population has been predominantly the baby boomers, which makes up 20% of our population, and the baby boomers are hitting 65. The final year of the baby boomer hits 65 in about a year or two. Sorry, in about the last year of the baby boomers is 65. So those people will be 65 in another, let's say, a few years. The fact of the matter is the next largest generation is the millennials, which is actually more than 20% of our population. So what are we doing to educate the millennials and how they're going to navigate the healthcare system? And what are we doing to create an infrastructure that's going to support that very large portion of our society? So we have a lot of work to do in so many areas. And the question really becomes, well, where the hell do we start? Where are we going to start? It's no difference than the issue in Vancouver with the downtown east side. Everybody's got something to say about whatever, but the fact of the matter is it's so overwhelming. Nobody has figured out where they're going to start. This is a very, very serious problem. And so we've reached a point in our lives where we're like, okay, fine. We'll just live our lives and hope like hell nothing happens. And when something really serious happens, we'll go to the hospital. And whatever happens after that, we're in the care of the hospital. And that's the worst case scenario, is that we now land up in the care of others in the hospital, which would have happened anyway. So in our minds, that's how we're navigating our healthcare. In the day-to-day of healthcare, we're relying on Dr. Google, which a lot of GPs don't like. But Google's important because it gives us things to think about and things to ask about if you have the courage to ask them when you are in the doctor's office. And we'll continue to work with our practitioner on the mainland. And if we end up with somebody over here, well, that's just great. But we're very realistic. We won't see that for another 2-3 years, maybe. So we're just going to have to wait for the crisis to happen, and then we'll fall into the hands of the hospital team. That's kind of how we're managing our healthcare at this time.
As Canadians, do you expect, is there an expectation, do you think, from either your part or on the part of Canadians to have a government manage this important part of our lives? Or because you've both sort of mentioned self-management, and I think self-management is sadly what it's come to. We all have to be our own best self-advocate with the healthcare system, but that's not in everybody's wheelhouse. That's not everybody's skill set. Annabelle, you mentioned for seniors, this can be a difficult thing, a generational thing, or just an age thing and a vulnerability thing. And, what if you're a newcomer to Canada, you're a recent Syrian refugee, perhaps there's a language barrier, plus there's, a bit of the white coat syndrome, perhaps, and just things like that. So, is it fair to expect, I don't like to think of myself as an entitled person. So, I think we've been raised into Canada. I was born and raised into Canada. That was where we were taught that we have a universal healthcare system that provides for all Canadians. But in this day and age, it seems like we have to self-manage. So is it a fair expectation? Is it a blended model? Is the responsibility on both the shoulders of the government and ourselves to be our own best advocates? Is that practical for anybody?
Yeah, you raise a great point. It's a very political hot potato, quite frankly. But and this will probably raise the hair on everybody's back that really believes that it's really up to the government. I'm not adverse to having a two-tiered system. I'm really not. I object to any government or any society that tells me how I would like to spend my money. It doesn't matter what your income is. You figure out your priorities. If your priorities are to look after your healthcare and you're in a position to do that, then I think you should have access to private healthcare. And by doing so, then you free up space for the people that truly, for whatever reason, cannot access. We're always going to have different levels of people in society, and that's the way it is. I mean, do we like it? No. Should everybody equal? Yeah, they should, but that's not the way the real world is. The real world is that we have multi-levels in any society, in any country, in any culture. So in my opinion, that if I decide that I want to use my money to access certain types of healthcare, then that's my prerogative and I should be able to do that. The problem with that is that if we have a big model like that, then the healthcare providers see the opportunity financially and takes them away from the public system. And so, and this problem exists in other things outside of healthcare, where we have public system versus private system. So, but I think that that is one thing that I would like to see as an option, is that if you would like to do that at your cost, okay, fine. Because clearly the government system is broken. Clearly the government system is not going to fix anytime soon. And clearly the government system is so far into this terrible state of affairs that I don't have confidence that in my lifetime it's ever going to get to a point where we can confidently put hand over heart and say, yeah, in Canada we have a great system. We have a decent system when you compare it to other countries. I've been in other countries and had to access healthcare. There's some stuff out there that I'm like, thank God we live in Canada. But the fact of the matter is, when you live in Canada and you have this expectation, if you do expect that the government is going to provide the healthcare that you think you should have, you need to lower your expectations or you're going to be set up to fail. That's really what I think about that. Very political, but that's what I think about that. And I will tell you right now, I experienced it with the one senior we worked with. You know, we were approved for the palliative care program here under the VHA thing. So one day I got a call from the palliative care unit to say, okay, you've been approved, and these are the services we're going to provide. And one of the services was personal health care, which we had requested, twice a week. I said, great, that's fantastic. What days? Okay, they could give me the days, and let's just say they were Tuesday and Saturday. Perfect. Okay, what time? Oh, well, actually, on each of those days, we will call you in the morning, and we will let you know A, who's coming, and B, what time. And I said, listen, it's a damn good thing I'm not working outside of my house. It's a great thing that I'm not raising a family and trying to juggle this senior. And further to that, I've got a senior that naps in the afternoon because they need to, and who's not well. And I just can't have willy-nilly you coming in this week at 8 o'clock and the next week at 3 o'clock. And further to that, it's personal care. I don't want just a different person coming in and doing that bathing and everything that has to happen. I don't think that's fair to that senior. And so because we were in a position to do so, I said, you know what, forget it. You guys give that service to somebody who needs it, who doesn't have any other way to get it. And we went private. Best thing we could have done. There was consistency. It was the same person. There began a trust that there was a time, there was a schedule, and it just worked for everybody involved. And so that's a perfect example about a two-tier system, just in that little example alone. So that's what I have to say about expectations on the government. Sure, you can have a dream world of, yeah, in a great world, it would look like this. The reality is, I don't think we're going to get there. So we have to be creative in how we're each going to look after our healthcare. And that's really where I stand on the issue.
On the positive side of that, We in BC are fortunate enough to be entitled to palliative care. It may not suit everybody's needs to the best of their ability. And I don't know if anybody's aware that also, if you have any major surgeries and come out of the hospital, you are allowed to have 2 weeks free of home care from VHA right now. And so use that if you need it to cut. Like I just had hip surgery in April. I couldn't walk. I couldn't take the garbage out. I couldn't warm up my meals I had my daughters come for 2 weeks to take care of me, which I was lucky to have. But 2 weeks after that, to change my laundry, change my sheets, and do that sort of thing. Because I'm on my own here. I live alone on the island. All my family are in the Lower Mainland. You asked about foreign trained doctors. All of my doctors have been foreign trained, except for maybe the specialists. You know, going abroad, a friend of mine went down to Mexico to get what is it, stem cell injections for her knee, that sort of thing. When I was teaching first aid and CPR, I had a paramedic nurse who had bad knees. She went down skiing in Washington so that she would injure her knee to get immediate knee surgery in the US of A on Blue Cross healthcare, rather than waiting 2 years to get healthcare surgery here in BC. So those are the kind of issues that all of us are facing. And as we age, and we have a disproportionate number of seniors on this island, so that creates an even more stress on the system. And the fact that we have such a low percentage compared to the rest of BC, and the fact that there are not minimum 97,000 people from all over Canada, around the world, moving to BC at the moment during COVID. How are we going to cope with more healthcare needs, more hospitals, more healthcare clinics, which aren't happening at the moment? We are not keeping up with the demand at all. I hear you. Believe me, I hear you.
Mm-hmm. And it's interesting to bring that 2-week thing up, because that's one of the things that we learned, and I kind of knew this anyways, because we've dealt with other family matters in the past. But one of the things that we became very expert in the last 2 years is really asking the questions and trying to understand how the healthcare system works in relation to these seniors, and navigating the system, and really being vocal about it. I mean, nobody offers up any information. This goes back to the education piece. Nobody offers that information up. I've had lots of friends who've had parents in hospital for various reasons, and they had no idea that those services exist. Nobody talks about those services. No. And so there's a break in the chain somehow. Is it because they're so hurried in the hospital and so taxed that there's not this person coming in to say, okay, just so you know, when you go home, da, 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 or is it a lack of the knowledge within that healthcare team? Is it that the system is so lean that they kind of secretly don't want to promote it? You kind of wonder. But at the end of the day, this goes back to this education piece. People don't know what is available. And until you get somebody that scratches at that itch and really forcefully, which is what we
did. The resources, yes.
Forcefully. I mean, we were forceful. I was like, I'll tell you, we moved here, and in 6 weeks, we had my dad in a clinic. We had him in palliative care. We had other resources. I did that in 6 weeks in a new community. But let me tell you, it was a full-time job to get there. And the number of phone calls I made and trying to gather how VHA works over here, and the fact that we brought in private services for some of these things, when I realized just how convoluted this whole thing was going to be. Mm-hmm. But that's like a dog of the bone who's got nothing else better to do all day. That was my main priority when we got here. And now, God help me if I was a younger person with raising a family and working full time and trying to do all this in between, and I can't even imagine it, to be honest. And so this goes back to the education piece. We're missing the information, and when you go to the websites to try and navigate the information, it's not all that clear. Government websites. I spend a lot of time on government websites because of the work that I used to do. They're terrible. You go down a rabbit hole and you aren't coming back, and then it just leads to all kinds of other issues. And so government websites, although their intentions are trying to be informative, it is really confusing. And then you have a language barrier. People don't know what palliative care is on that example. When you say palliative care, everybody assumes, oh my God, that person's dying. No, actually palliative care means more than looking after somebody that's dying. It's not all about an end of life. And so people have this misconception on things like palliative care. or a misconception on things for seniors, independent versus assisted living. There's a whole misconception on what that really means. And then the next tier after that, which would be palliative care. And so this goes back to the education piece. So doing a better job of teaching people in the healthcare system to communicate whatever resources exist out there, and then having a follow-up mechanism in place to do that. So in your case, going home from surgery, is anybody following up? Is there anybody that's following your story? And then the public being educated on what exactly is available. So it's a very convoluted system. And so if you aren't bullish about figuring it out, or you don't have the wherewithal because of a language barrier, or maybe you're just not as well read, or or maybe you have a disability, or maybe you're so sick it's just overwhelming.
Or seniors that don't even know how to use a computer.
They don't know how to use a computer. It's just, yeah, it's a big problem.
Huge.
Yeah.
I'm concerned. I am also concerned during COVID for my children and grandchildren right now. My oldest daughter is a family mental health practitioner on the Lower Mainland and is overwhelmed with the demand for both in her personal and professional life. My other daughter is an unvaccinated 811 BC RN, was an operator, but lost her job. Now I can't even get a response on 811 to register with the health link unless it's an emergency related to COVID. Yet COVID and healthcare workers with COVID are allowed to work on the front line. So where is it going to end? It's a very serious problem, and it's getting worse, especially with COVID right now. And there is no end to it. So I really strongly advise anyone listening to this that need to go out and make your voice heard. I'm going to send you some links and phone numbers and websites to follow up and advocate not only for yourself, but your community in Qualicum Beach for primary healthcare providers. We are in dire need of them, definitely.
Yeah, I'd like to think that this will be an election issue, both at the provincial level and the federal level in the next elections. I can't help but think it won't be one of the top 2 or 3 issues. Unfortunately, or fortunately, unfortunately, I guess in most cases, other things seem to take priority election after election. The economy, the pandemic, and there's always going to be something that sort of just bumps the family doctor shortage down a few notches. But I think right now we really are at a critical point. And I'm saying this as sort of a casual outside of observer. But there are a lot of folks, in the Times Colonist did an article the other day. I think I'll post a link for that, with a family doctor that was talking about just how dire the situation is. So it's very, I think we're all in this together here. And Vancouver Island is very much at a critical point, I think.
Well, the average age of doctors on the island are 50 years plus, and many of them are retiring, and they are not being replaced. And that is a huge problem. The citizens of Qualicum Beach deserve to have access to a primary healthcare provider in a timely manner in BC as per the Canadian Health Act. By law, we deserve to have that, and we are not getting it. So I advise everyone that's listening to this to speak to your MLA and VHA or any of your other healthcare providers and make your voice heard. It needs to be heard because it's only getting worse.
Yeah, the other issue is it's not, I wouldn't say it's a geographic issue. I mean, certainly, Maria, I understand the stats for the Vancouver Island, and we
number of seniors, huge.
For seniors. And, we came here knowing this was going to be an issue. And so that's the other thing, is it's also part of, we all have to think, I mean, I'm not saying that this is excusable, but we have to think about this. If we know that the Vancouver Island is full of seniors, and we know that there's a shortage of clinics and all the rest of it, it may actually be that maybe this is not really the best place for you to move to after all. Like, if healthcare is important to you, maybe Vancouver Island is not your ticket.
No.
And so, but really this issue, it's a Canadian-wide issue. It's not specific to any geographic region. No. I read a great book. I'm sorry, I just drew a blank on it, and it's not in my office here, but I'll send it to you actually, and you can put it on the thing. It's written by a guy that actually writes for the Globe and Mail, does a lot on healthcare. And what he did was he wrote a book prior to the pandemic, although it did come out during the pandemic. But he wrote a book about the history of the healthcare system in Canada. And it was very interesting to read it. I couldn't put it down because I thought it was absolutely fascinating as to how we got to where we are today. And although it's not to make excuses for where we are today, it gives you an understanding as to how we got here. And we actually may have to work backwards. And I think this book is a great tool to really understand how we went from not having a Canada-wide healthcare system to when it was first introduced, but what was going on in Canada prior to the introduction of a national healthcare system and the expectations behind that. And then even further about once it got going, which started in Saskatchewan with the NTB government, once it got going across the land, how it's changed and morphed and what are the systemic issues and what are the newer issues. And it really gets into a lot of details. A tremendous amount of research has gone into writing this book. I think it's fascinating and I will send the information along. And I think if we can refer to that as a resource, we may need to work backwards. And again, we're not, you and I and the people that partake in this program that you're doing, we're not going to change the world. And I don't know if the information or things that we're saying are actually going to make an impact, because it goes back to the thing I said earlier. This is such an enormous issue. I don't know if we actually can get out of it. I really don't. No. It's like the downtown east side. There isn't, we talk about it all the time. We know what the problems are. The government knows the problems are. It is on the platform of most elections, whether they're localized or across or federal. But the fact of the matter is it doesn't change. It just gets worse. And so what we may need to do, and it's not ideal, we as users, we may need to change how we manage, how we navigate and how we manage our healthcare. We may need to adapt to the broken system.
Absolutely. Absolutely.
There's no other way around it, because we're not going to change it. We can advocate all. I mean, Adam Walker here is the guy that's really all about the healthcare and blah, 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 blah. Because I think you're in Qualicum and so am I. So he's really big on Oceanside and he's the guy to go to. Adam Walker's not going to make a damn bit of difference in the healthcare system. Doesn't matter what he advocates.
He told me to go dial 811. I couldn't get a response.
Yeah, he's not. He and no one else. No. So really, we have to change our attitude to the healthcare system. How does it work? Understand what the terminology means. What is a health practitioner? What can they do? What can't they do? Understand what happens to you if you end up in this system. What I talked about earlier, as soon as you step over that hospital threshold, that's it. Everybody else, they disappear. Understand how to speak and how to navigate through the system, the kinds of questions to ask, which is why Google's been great, the kinds of questions to ask, to hold your healthcare practitioners accountable, your nurses, your doctors, your specialists, your ambulance people, anybody at all that's involved in your care, you're holding them accountable, being tough, asking those questions. We have to retrain how we manage ourselves in the system, because the system's not going to change. And that to me is where you'll have success in managing your care.
Well, I waited for over a year to see the pain specialist in Nanaimo. I finally got in to see him. Oh, you just need the steroids for your hip. You don't need hip replacement. A year later, I go to see my physiotherapist. She goes, you need more x-rays. I went back to see him 3 times. I said, have you looked at my x-rays? 3 times. Oh, yeah, you do need it. It's bone on bone. It comes to the point where I've got bone on bone. I've literally worked myself to the bone. I can't work anymore. I can't walk. Does my health care have to get to that crisis stage before you do anything? Mm-hmm. You know, it's terrible. Yeah. I'm not making excuses and I'm not pointing fingers, but you know, it's a sad situation and you have to persist. My daughter, who's an RN, who had who had ovarian cancer, pardon me. For 6 months, there's a history in my family. My sister had it. She caught it early. She went for in vitro fertilization. That's how she caught it early. Otherwise, she probably would be dead. God bless her. But my daughter, for 6 months, she complained and went to emergency. Finally, they found out that, yes, she did indeed have ovarian cancer. So you have to keep pushing. You have to keep driving. You have to be aggressive, as you say, for your own health. You can't just be blind and expect the healthcare system to take care of you, because it can't. It's overtaxed. You have to learn to manage your own chronic illnesses. And the older we get, the more difficult it becomes when our cognizance and our ability, our healthcare, to be able to manage our healthcare becomes a lot more difficult. And more complicated. I spoke with the doctor at a drop-in clinic, walk-in clinic in Duncan at the Superstore. And I asked him about the young doctors, and all of I think most of them were from South Africa at the time. And he goes, most of them do not want to work in Qualicum Beach, where 50% of the population is over 65, because of the complex care required by seniors here. It takes a lot more and effort, and it's a lot more difficult for those doctors to deal with us than they are for people walking with a sore throat or a cold or whatever. Although it is what it is now with COVID. So there you go. And that's from the doctor's mouth. So yeah, definitely.
I have encountered foreign doctors, and in fact, in the time in the mainland, we had 4 retirements. I think it was twice that we had, at least once, but I think there was a second time we actually met a foreign doctor who was taking new patients, and you're absolutely right. Like they want the varied medicine. They don't want to be in it's hard on the practice financially, because and that's the other thing in healthcare. But we have to remember, I don't care what anybody says. Supposedly, we never talk about it being profitable. No one's here working for free. Let's be real. No one's signing up to be a doctor, putting themselves through school and all the arduous process to get that
student loans and everything else. The
exactly.
Stress, long
to
hours.
go to work for nothing. I mean, we're not in this because it's in our hearts. They're in it because there is some heart there, and there's a passion.
Well, it's got to be a calling too to succeed.
Yes,
but
there's
got to be some passion.
Money. There's incredible investment there. They have to make money. Nobody in their right mind, even if they're not that business oriented, nobody in their right mind is going to sign up for a situation where it's bleeding them dry to run their business.
Absolutely not.
So whether we like to say it or not in healthcare, this is a business. It truly is. And you know what? That has shown itself this year alone in technology, because we went from doctors practicing in their clinics to realizing, oh, actually, there's technology out there. I don't have to get up and go to work. I can work from home. I can video call 1 million people and bang off X amount of appointments in a short amount of time. I can have all the healthcare records at my fingertips now, because we have access to the information through one system rather than all these handwritten notes and all the rest of it. So for those who've embraced technology, they've realized, oh my God, we can work way more efficiently and at less cost, and can generate more patients in an hour than we ever used to. So it's a business. I don't care what anybody says. It's a business. The guy that had the clinic that we started with in our last round of changing over on the mainland, he's the guy behind the development of an app. He was like 8 years ahead of his time. We were doing video calls with that doctor's clinic 8 years ago. So he's left being a practitioner, and he's over there on the other side promoting his thingy and selling it and making money hand over fist. And so it doesn't matter how we look at it. It's taboo to say it's, healthcare, you make money. Yeah. Guess what? There's got to be a business to it.
Some reward. But it's not just that, it's the quality of life to work. Do you have proper vacations? Can you have a varied schedule? These doctors are so burnt out. I can't even look at those kind of things, the quality of workmen in their workplace. Do you know what I'm saying? So it is a huge problem, not just the bottom line.
That's right. And it starts actually earlier in their career, because there's sort of this hazing that goes on when they get to the point where they have to do the practicum, when they go to work at the hospital for 18 months, 24 months. They get all the dog shifts. They work 3-4 days without a break, all these crazy hours. And you have to do that to show your mettle. Well,
so unhealthy for your body to do that too,
That's right. And then how great are you on your 4th day and you're in your surgery, you're doing your surgery, and, we're human beings here. And at the end of the day, how effective are you at being a doctor if you are exhausted because you've been on your feet for X amount of days in a row? And so, this is, in terms to be a doctor, if you don't do that, then you're not worthy of having your PhD. And so this is a systemic old boys club problem, actually. And so it starts there. So it goes back to what I said earlier. We have so many issues that are underlying issues here, and systemic issues in the pipeline. I just don't. I've given up trying to figure out ways to solve it, and instead I'm putting my energy in terms of how to navigate it. Because really, at this point, it's going to be about me and my family. And whatever I need to do, whatever levers I need to pull, private or not, I am going to do those things as long as I possibly can.
Stay strong, Annabelle. Don't give up.
I've made sure I've educated the youngers to say, listen, my time will come. This is what I
Speak up.
expect. You've seen what's gone on. You better show up.
Yep.
Yeah.
We all got to pull our weight as best we can.
Yeah.
Well, thank you, Adrian, for giving us this opportunity to do this tonight and say our piece. And hopefully the powers that be will listen and do something about it, as well as the public.
Yeah, it's my pleasure. And as you say, the public as well. It's just as, I guess, managing our own care and being our own best advocates. We also have to advocate for better healthcare. So I look forward to and expect to see this being a major election issue. And I don't just mean, because, Annabelle, you mentioned that it's been an election issue in the past. I think this could be the foremost election issue potentially. I think a lot of us, my final comment is, a lot of us like myself kind of just live blissfully unaware until we need the system, until we need to go to the hospital, or until we need, we're in a car accident, God forbid, and we need some extended care, and that might not be there the way that we think it might be, or we just don't even think about it. So this is definitely, and I can't stress it enough, this is, and again, one final time, I'm an outside observer, so I certainly hope there are politicians and policymakers watching and listening, and listening to the folks of our province. But our province, maybe we need to, as British Columbians, lean on those folks a little bit more. And Marie, as you said, you'll provide some email addresses for MLAs and things like that, because that is their job. They're representing us, and we need representation in this area. So
yeah, I think part of that process is that, and this is very common in society, when society identifies a problem, they're all about, this is the problem, this is the problem, this is the problem. We also need to come to the table with the solutions, because the person you're speaking to may not have the solutions. So we have to, as a society as a whole, whether it's your MLA and the public that are speaking, everybody has to be talking about, okay, well, we understand what the problem is, but here are some solutions we need to take into consideration. But I suspect that many times there's the cry of the problem, and that's it. So, and that's fine,
As far as it goes,
but we can't expect the Adam Walkers of the world to have all the solutions either. They're not,
no.
He may not be personally affected by the healthcare system, so he may not even think about a solution that some of us know about because we've been impacted personally by it. So no matter what happens, when the world squawks, we absolutely need to squawk, and then absolutely have some solutions to bring to the table.
Absolutely, you're absolutely right.
And hope it listen. I mean, this is the challenge here again. And sorry, my final point is that our hands are sort of tied. We've been raised and brought up in a system where we were taught the government has your back when it comes to healthcare. You are in a universal public healthcare system. I'm very much in favor of a private sector and a free market, but I accept that our government is running this aspect of our lives. And so for me, really, I don't see anything that I could do apart from writing a letter to my MLA. Now, perhaps individuals can propose different solutions, but I just don't know how much. That's why I think we squawk, because I don't know how much they're like, the private sector can't really step in tomorrow and say, we're going to start, doing knee and hip replacements. I think that's a huge backlog right there that could be cleared out perhaps by some sort of private intervention. But again, it's sacrilegious, I think, in Canada to say these things. And I'm all about equality, and I don't think it's fair that there are folks who maybe have lower incomes and things who can't access those resources. But again, like, what do? We're hamstrung here. We're really stuck in this. So,
well, my orthopedic surgeon said to me, he goes, we cut our surgeries down after I luckily got in, and they're bringing COVID patients down from up north, and that's what we're dealing with. I know that the province is now trying to deal with that backlog of surgeries and diagnostics, but it's going to be catch up. It is catch up. There's no doubt about that.
Well, fingers crossed for all of us. And any final thoughts?
Try and stay healthy.
Try and stay healthy.
Try and stay healthy. That's all my biggest advice to you, as best you can.
And unfortunately, we're in a pandemic, so
yeah, good luck.
But yeah. So any final thoughts before we close off here, sign off?
Stay safe. Thank you so much for this voice to be able to provide. Thank you.
Thank you for being here. Thank you so much.
Great.
Stay well.
Thanks very much, Adrian. Appreciate the opportunity.
My pleasure. Thanks for your contribution.
Take care and stay safe.
Okay. Good night.